Hi all, and welcome to our event on improving access to retail naloxone. Before we jump in too quickly with introductions, I'll give folks just a minute or two to keep getting into the room. But really appreciate people taking the time to join us today. All right, let's go ahead and get started. So, as many folks might know, we have started to see some declines in many groups across the country in drug overdoses. Um, Unfortunately, right, it remains a top cause of preventable death in the United States. And even with these declines, we're losing tens of thousands of people in the United States every year to drug overdoses, and still most of those are related to opioids. One of the best solutions we have to help save lives is naloxone. It's a safe and effective medication that reverses opioid overdoses and restores breathing within minutes. However, for this life-saving tool to have an impact at the population level, right, we need to actually get it to people who use drugs. We need to get it into the hands of their friends, their loved ones, and increasingly our communities at large, especially as we see more public space overdoses, right? We're at a point where the more people who have naloxone, the more lives we can potentially save. Um, Doing that means we need to have consistent low barrier access to affordable doses of this medication. And while syringe services programs and other harm reduction and public health organizations in communities are often a primary distributor of free and low cost naloxone, pharmacies do and can fill important availability gaps. They have longer hours, they're in more places. So we're going to talk a little bit about this. We're going to talk today about what gaps those fill, what populations might benefit the most from pharmacy access. And most importantly, we're going to talk about what are the current issues in pharmacy access to naloxone and what is being done at a policy and I guess retail level to make it better. So I want to welcome our speakers and thank them for being here. And then we're going to go around and I'm just going to let them introduce themselves because they'll do a much better job than I will. So let's start with Catherine Neal Harris, please.
Yes, thank you, Stacey. Hi, my name is Katie Harris. I'm a drug policy fellow at Rice University's Baker Institute for Public Policy. I focus on a lot of different drug policy issues, especially at the state and local level. We look a lot at different overdose response strategies, and access to naloxone is one of those. So happy to be here and part of this conversation.
Thanks so much, Katie. And Marianne Gibson with NGA.
Thank you. Good afternoon, everyone. I'm Marianne Gibson. I'm a program director on the health team at the National Governors Association Center for Best Practices, and happy to be here.
Thanks, Marianne. Bridget Groves, could you please go ahead?
Sure. Hello, everyone. My name is Bridget Groves. I am a pharmacist, and I'm the Vice President of Professional Affairs at the American Pharmacists Association. APHA is the largest organization for pharmacists that's advancing all the different aspects of services and settings that pharmacists and pharmacy personnel practice in. And I'm pleased to be able to be here today with you all on behalf of the profession and to address some of the issues and concerns with accessing naloxone, but making sure that it is truly accessible with the decreased amount of stigma available to our patient populations across the country.
Apologies for my dog in the background, the joys of remote work, living in a busy neighborhood. And finally, thank you, Bridget. And then we will turn to Beth Dinges for, if you could introduce yourself.
Sure. So I'm Beth Dinges. I am a pharmacist and I now work at a VA in Danville, Illinois. Pretty rural serving, sits on the Illinois-Indiana border. And I've been with the VA for now 20 years.
Excellent. Welcome all of you. Thanks again. And let's go ahead and just jump right in. We have a lot of ground to cover in the next hour or so. So, yeah, I'm excited to hear your thoughts and share those. So I want to start with, at this point, most of us who've been working in overdose prevention in recent years have heard the term community saturation when it comes to naloxone, right? Officially, this usually means getting enough naloxone to community members to reverse something like 80% of overdoses. Less officially, it tends to mean just getting as much naloxone into the community as we can. So, briefly, I just want to have you all explain some of the current ways that we are getting naloxone into communities. What are some of the most important things? So, I'd like Marianne and Katie, maybe we can start with, maybe even Marianne, you can start with why harm reductions in particular have been such an important provider of naloxone.
Sure, thank you so much. Well, we know at this point that naloxone is a highly effective tool in preventing overdose death, and it's most effective when in the hands of those who use drugs or are most likely to witness an overdose. And harm reduction programs are uniquely positioned to particularly serve the communities that are at greatest need. So they do amazing work through syringe service programs or street-based outreach, reaching those who are at greatest risk for overdose, therefore being a very effective provider of the medication. And I found a really great resource from our street, and that showed how prevalent the community-based distribution was, which shows that nearly half of naloxone is distributed through community-based programs. So really, really important. And there are many laws and policies that have really enabled the community-based distribution through naloxone access laws, allowing community-based programs to purchase directly through the state at sometimes no cost or low cost to them, to make sure that we're able to get naloxone into the hands of those who need it the most.
Yeah, thanks. And I think that is, it's really important to recognize that we still are seeing most naloxone going into the hands of people through these harm reduction organizations. Um, Katie, is there anything you'd want to add around like what that access looks like through these organizations, or what specific policies can help and hinder
Yeah,
harm
sure.
reduction
Yeah,
access?
yeah, sure. So I think one thing, right, is that with as far as harm reduction organizations go, obviously some communities are more equipped with that infrastructure than others. And so I think part of the thing is thinking about other kinds of community providers as well that can reach these populations. And here where I live in Texas and in Houston, for example, we don't have a huge harm reduction infrastructure, in part just because of the way that our state has approached different kinds of policies related to harm reduction. But what we have seen, is this kind of very concerted effort to push naloxone out to community providers, and maybe not necessarily harm reduction ones, but other sorts of providers, especially in rural communities. And so, just as an example, one of the big grants that our state has just provided with its opioid settlement dollars is for naloxone access around the state. And the recipient of that grant has to have a plan to get it into all regions of the state, right? I mean, Texas is really big. There's a lot of, very rural communities. And so that effort to acknowledge the need in those communities, I think, is really important as well.
Yeah, thank you. And I think that's such a good, I mean, that's a great segue into the rest of this conversation, right? That not every community has these sort of type of harm reduction infrastructure that we often think of when we think of it, right? It's not always syringe services. It's often these other community-based organizations, because harm reduction has always been a community-based effort. It's something that has always come from the people who are working with and serving, and often folks who use drugs themselves have been a part of making this a reality. And the other piece that I think, both of you have touched on that's essential as we go forward, and something our street talks about a lot when it comes to harm reduction and health programming, is the importance of communities tailoring things to what makes the most sense for them. So obviously, as we've sort of noted, harm reduction organizations are super important. Community-based organizations are a great resource, but they're not reaching everybody who's at risk for an overdose. Retail pharmacies do have the potential to fill a gap. Beth, could you maybe talk a little bit to give us some context around access for veterans? What does that look like for veterans at the VA? Where do patients need to go when they need naloxone? What are their options?
Sure. I think the VA does a great job of pumping out naloxone for probably past almost 10 years. It is prescription only. And I mean that a patient has to have a prescription specific to them, like say John Doe. We don't have it sitting on counters or, that where patients can just readily grab it. There is never a copay, which is helpful. There are, one of my biggest issues is the prescription only access piece because it limits access to the people who need it the most. Often people who are using drugs and might not be the most engaged in their healthcare, because it takes a prescriber to get that prescription. Then it takes an address to mail it to, or you need to get to the pharmacy to go pick it up. And then there's a lot of I think most veterans don't use the VA. And some are ineligible for medical services. Maybe they were discharged due to, substance use in the military. Maybe they're not enrolled in the VA. We have some veterans that receive housing services, but they're not eligible for medical benefits through the VA, meaning they can't get a prescription for that. And that's problematic in communities where our VA, which, pretty rural serving, and a lot of the pharmacies are closing down. So it's a problem of where to send them. And I think I've seen some shift within the VA, but I think historically the focus has always been on prescribing to those patients on prescription long-term opioids. And I see a little bit of shift towards patients with stimulant use disorder or patients who use illicit drugs. But historically that's been the focus, those long-term opioid patients. And we know those aren't the ones that are really dying, right?
Yeah. Yeah. No, and I think, this point about to get a prescription, right? We need to have a prescriber, and the potential risk of folks not being engaged enough to get that, to have that is a really important reminder. And that's part of why, even though, again, community-based organizations are often the most effective way to reach this particular population, that's also where we see the promise for both low barrier pharmacy behind the counter access, right? Where we have not like you don't have to have an individual prescription, or retail over the counter access. Bridget, I wonder if you could talk just a little bit about what's the role of pharmacists in getting naloxone to people, and sort of who does pharmacy-based naloxone serve?
That's a great question. And, maybe we start with, who does pharmacy access to naloxone serve? Anyone and everyone, really. I know my colleagues have mentioned that there have been some pharmacy closures, and we have seen a number of pharmacies close. That said, there are still well over 45,000 open pharmacy locations. So there's still a lot of available places for patients and families and caregivers to get to in order to get the either over the counter or behind the counter or prescription only naloxone products. Many of the states that pharmacists are practicing in have the ability or the authority to either write a prescription through a standing order or do some other mechanism in which that would allow that pharmacist and that patient or that caregiver in that moment to write a prescription, to be able to fill it maybe through that patient's insurance, since they wouldn't have either a high cost, or they maybe don't even have a cost at all because it would go through the insurance plan and be able to cover some of that cost of it. Because we know that that can somewhat times be prohibitive. We also know now that there is over-the-counter naloxone, both brand and generic availability, which again helps to decrease a barrier, meaning I can walk through the aisle. I can hopefully grab that if I need that for my family member, for myself, or to have that just in case a need may arise. And that's a great way to have access to that. But similarly, on the flip side, it is somewhat cost prohibitive depending upon, a person's income status or just a variety of other variables and factors. And so we want to make sure that that still is something that they could access. So we've seen a lot of Medicaid plans, for example, across the states add that over-the-counter option to their preferred drug list, meaning that if that patient has it prescribed or that pharmacist using their prescriptive authority in that state, as it might be specified, could then order it, and that patient wouldn't have a copay at that spot either. So pharmacists are, in a variety of different locations and communities, and I think there's a great option for them to help to really work hand in hand with those community-based organizations to assure that this is just another available option for where patients, families, and caregivers could access naloxone.
Thank you. That's super helpful and a really useful summary of sort of the complex policy landscape that does make naloxone a little bit more available at pharmacies behind the counter and over the counter. One thing I do want to highlight, especially with regard to behind the counter access, I don't know if Marianne, maybe you can talk a little bit about some of the barriers, or Beth, since you mentioned the recent study, some of the barriers that we do see to behind the counter naloxone that yeah, even when we have these good policies in place, right? What kind of keeps people from getting naloxone behind the counter like that?
Yeah, I can start off and then hand it over to Beth. You alluded to it, I think just the act of presenting to the counter, asking for the medication, and then having to show and process your insurance can be a barrier. And I know that it is covered through Medicaid, but if you have commercial insurance, sometimes the copay for commercial insurance can still be a little bit more costly. And then there is sometimes access issues with even getting the medication at the pharmacy. Sometimes pharmacies are not stocking the medication in sufficient quantity. So if someone presents, they may not be able to walk away with the medication in hand if they don't have it there. I know that there are some issues related to stigma and needing to then just provide additional information when you're trying to obtain the medication, which I know, Beth, we were just talking about on the pre-call. So if you want to mention a little bit more about that.
Sure. Yeah, I know I was looking at a recent publication. This was referring to over the counter, meaning like naloxone that's on the shelf. But I was like naively like surprised. Like I thought every pharmacy stocked it on the shelf, but I was, what I was reading is only 55% of them stock it on the shelf. That shocked me. And I think, Marianne mentioned just like the act of like presenting to the counter, right? Especially when there's a long line and people are right upset and frustrated and there's yelling going on. I mean, it just doesn't, that's not a low barrier way of accessing naloxone, right? And I think, yeah, asking like veterans who exclusively use the VA, sorry for the dog, for the VA or use the VA for their healthcare, and they get all their meds through VA pharmacies, asking them to go to the pharmacy for this added step, I think is a barrier. And a lot of those patients don't have commercial insurance or can't afford the $45 over the counter cost. So it's yes, the access point, is there theoretically, it's behind the counter, but it's a lot of work to get to that, to get it into your hands. Especially if you don't have especially if you don't work in healthcare and you're not aware. Like I feel like it's kind of hidden, right? That it's like that you can get this without a prescription specific to you from behind the counter.
And
Yeah. Oh, go on.
I was just going to add another thing that when I was with the state of Maryland, something that we had heard, which I'm not sure how true it is anymore, you all may know, But even if you present your insurance and then you access the naloxone using your insurance, sometimes that information could then be used like as someone, if they were going to apply for life insurance or something else, like that information was then tracked. And I don't know if that's still an issue that is prevalent. I know in Maryland, it was something we were tracking, but even having that like maybe on your insurance record could prevent people from wanting to leverage their insurance to access it behind the counter.
Yeah, I think this is a really important point about one of the challenge, like that challenge of using insurance to cover naloxone behind the counter. And it's something that comes up as a barrier, right, for people to buy naloxone, not only for themselves, but for a loved one, right? People are maybe afraid, and especially in rural pharmacies too, maybe they're afraid to buy it, use their insurance, and then if they know the pharmacist or they know other people who work in the store, it can be a scary thing to do because you open yourself up to people knowing more than you might want them to know about yourself or people in your life. Yeah, and I think so. Thank you for that clarification about the VA, Beth, because a lot of us don't really know how that system specifically works. And I think, right, so if I'm understanding correctly, one of the issues with OTC versus prescription access to naloxone for VA members is that a lot of them are using VA pharmacies, and the VA pharmacies aren't stocking it OTC.
Correct. I
Okay.
know there's been a lot of talk of like, every VA has these retail stores called a canteen, which is kind of like a mini pharmacy. There's a lot of other clothing, lotion, you name it, in there. Those currently, they don't sell naloxone. I know there's been a lot of talk to make that happen. But yeah, the way it stands, like you can walk up to the pharmacy and say, I don't have a prescription, and then the pharmacist can enter one for you. So that's another, point, and that there's no copay on that. So that's a nice thing.
Yeah. No, for sure. And this is where when we talk about pharmacy-based access, right? It's people are sort of having to balance in a lot of cases whether they want the anonymity of OTC or the affordability of something covered by their insurance, which can be really, really challenging for a lot of folks. And I think this conversation around some of the barriers to OTC access sort of pushes us into the next phase of this chat, which is, recognizing that pharmacies and specifically over-the-counter naloxone can play an important role. Hopefully seeing it on shelves. One of the things that we were really hopeful about at our street was seeing naloxone on shelves would reduce stigma, right? Just if I just go buy painkillers and I see naloxone every time I do, maybe it's not so upsetting socially, right? But what is the reality? And this is recognizing research takes a long time to publish from when it's happened. So our knowledge is a little bit limited, and things are changing really rapidly. But I'd love to hear if, Katie, maybe you could start by explaining a little bit about what we know about over-the-counter naloxone at this point, like, and retail, and is it available? Is it affordable? Is stigma still a problem?
Yeah, so we looked at this in the Houston area last year, and so what we had found was, we called pharmacies in all zip codes and found that the majority of them, about 3/4 of them, said that they carried naloxone, like over-the-counter naloxone. But of those, it was like 71% said that it was in either behind the pharmacy counter or like in a lockbox or in some other part of the store that required staff assistant to access. Um, and when we had asked a few of these folks about why that was, and one of the answers that we got from people was that way it couldn't be stolen. So that was like one concern, and I think, certainly naloxone is not the only thing you see in a lockbox at a pharmacy anymore. I mean, they lock up soap and things like that because of these larger concerns about the theft. But that was a big reason. The other thing that we found was that, like, specialty pharmacies like that were either like, especially if they're like compounding pharmacies, but also some of the independent pharmacies were less likely to carry it. So that was another thing that we saw as well. So I mean, and of course, these numbers might have changed since we looked at it, right? Because the things are kind of changing. But I think that I think somebody had mentioned earlier, right, that like if people go in the store, they might not know, like if it's behind the counter, that it's even accessible. And there are some stores that have actually done a really good job of putting it like up front and center, like so you can see it when you walk in. But if it's not like that, then people might not even think about it, right? Or even realize that it's available. And so that kind of, not even just the stigma, but just the awareness that it's available and just putting in people's head, like, oh yeah, this is something that I should buy while I'm here. And oh yeah, and then about the price. Yeah. So like most stores sold it for the retail price of like $45, right? So it was around that price. Some sold it for, like, I don't know, it was like $120 at a few of them. I'm not sure why that was. But yeah, the majority like sold it at that suggested retail price. Which maybe like if you're a parent who's like very concerned about your kid, you might be able to afford that, but if you're actively using and that kind of thing, it can be kind of a cost barrier. And certainly I think is a cost barrier to the idea of like just bystanders carrying it, right? Like encouraging people to just be carrying it on them. That price I think can certainly be a barrier to that type of community saturation.
Yeah, definitely. Bridget, I saw you came off mute. Did you want to add something?
I did, yeah. Thanks, Katie, for those examples. I think one of the things I wanted to potentially help to clarify from the price standpoint. So, yeah, we've seen variability as well from that, middle $40 range all the way up to that $100 and plus dollar range. Those prices are set by the manufacturers, and so unfortunately, there's not usually a whole lot of opportunity for that individual pharmacy location to make modifications to the price itself when it is over the counter. And so I agree that's one of the challenges. We're really excited about the opportunity for there to be over the counter availability because of the great access that it does offer. But then on the flip side of it is the challenge with the cost differential and making sure that those are things that that a parent, a caregiver, a loved one who, a bystander is aware of. And if there's other, offsets that they might be able to utilize, like their HSA account or their FSA account, or having, programs set up within the community where they could potentially have, vouchers issued for caregivers or for individuals to then utilize those vouchers. We've seen that to be successful. Another thing I wanted to add is it is challenging, I think, for patients, for caregivers to know what it is, where it is available. For your point, Katie, about having some places might have it like right up against the window or the counter, so you easily can see that. Whereas we've also seen some things where there's like window clings or stickers that indicate like ask about naloxone. But then that does enter into the space of, gosh, am I willing to put myself out there and to ask some of those questions of the pharmacist or of the team there? So I know that is, again, one of those balancing pieces.
Yeah, thank you so much for that clarification, Bridget. And thinking about the role of the manufacturer in setting prices, I know for the primary brand that's out there, the recommended retail is about $45, but not $120, right? So is that a pharmacy decision or is a wholesaler decision maybe that's happening at that level? And yeah, what is, as we'll start to it's hard to talk about this without thinking about solutions, right? Like,
Yeah.
what is the role of like competition in helping fix that problem?
Yeah, that's great. Yeah, my understanding for those that are higher, it might have to do with what they have been able to acquire it through their wholesaler, through the manufacturer programs, that they're not independently setting an exorbitant price tag with that. So it might make sense to your point, like how can we help to have some additional market pressure to the wholesalers, to the manufacturers to bring that down, recognizing that it does take time, of course, for new processes to get established for production. But on the back end, now that those have been, is there a way to then offset some of that cost to assure that the public does have access to this at a reasonable price point?
Yeah, for sure. And we do see, we do know that market pressures, right, are playing some role on this. We see pretty consistently that chain pharmacies who have more bulk purchase power are selling naloxone at lower prices than independent pharmacies. They also tend to stock a bit better. They're more likely to carry it than your independent pharmacies are. Which could potentially have implications for communities for maybe rural communities that might be more dependent. The rural, non-rural gap in access, one of the things we've seen from research has been super mixed, is what I've seen so far. So some regions, like the Northeast, rural pharmacy access, OTC access is better in rural pharmacies than it is in non-rural pharmacies. And then in other communities, it's the flip in other parts of the United States. So that's something that I think is still playing out. And something that we've been talking about, I know in this group prior, is the potential role of generics as they start to come on the market more, in the hope that that can help be part of this process of bringing those OTC prices down. Generics have started to enter the OTC market this past fall, so we'll hopefully start to see more of that. I don't know if there's anything else that we've heard that any of you would want to add that you've heard that are additional barriers to OTC access that have been coming up, or to the pharmacies stocking and making these things affordable, right? Like, are there fears that have come up in addition to like that fear of theft? Are there barriers we've talked a little bit about OTC poor OTC coverage by insurance companies. But is there anything else that you all want to add before we move on to looking at solutions?
I could want to just highlight, we've talked a little bit about like the pharmacy closures. And I think it's just important to highlight where a lot of these closures are happening, because they do disproportionately tend to happen in minority neighborhoods and low income neighborhoods. And so you have people that, again, when we talk about like the affordability, right, the places that they're most likely that these pharmacies have been closing are places where the customer base is less likely to have private insurance, right? It's like the Medicaid coverage or the no insurance. And so that I think is a barrier. So I think that those closures don't necessarily affect all populations equally. And then the other thing I think was just interesting, Stacey, that you mentioned kind of the variability in terms of like rural versus urban access. And here in Houston, right where I live, it's in very obviously an urban area, but it's very spread out. And there was a study recently that showed that 65 zip codes in Houston have no pharmacies whatsoever. So yeah, people would have to go like 2 or 3 zip codes over to get to any pharmacy. And maybe, that's not necessarily like super long. We're talking like 3 miles, but if you don't have a car and you're living in a place that doesn't have good transportation, then that's certainly a barrier. And I mean, obviously not just for naloxone, but for, prescriptions generally. And so I think it's important to think about how these closures, impact access for populations that, are kind of vulnerable and at risk for, for overdose and for other kinds of health conditions as well.
Yeah, absolutely. And it potentially undermines the role that the pharmacies could have in helping fill some of these access gaps. So moving forward to sort of think about some of the things that are happening or could be happening or should be happening to make naloxone more affordable and available, arguably at where we don't want to just say at pharmacies, because with OTC status, that should give us the potential to go beyond pharmacies as well. So yeah, Marianne, maybe you could talk a little bit about if there's examples of state solutions that you've seen that have improved affordability or availability of retail naloxone?
Yeah, thank you. So I do think that this is an opportunity for states to lean in a little bit more. We at NGA, we work with governor's health policy advisors and executive branch folks. And I did do a quick survey with them just to see like what are they doing around supporting pharmacy-based access. And the consensus that I got back was that they're primarily like still working with their community-based organizations. And it didn't seem like there was a lot of concerted effort around a pharmacy strategy. So I think there's a lot of opportunity there. But a couple of interesting things that are happening, which Stacey, you actually alerted me to what California was doing with Governor Newsom partnering with the pharmaceutical company Omnial to then have a California branded version of naloxone that is available over the counter for $24 for 2 doses, which is below what we've been hearing about the suggested retail price. So that's really interesting. And after we talked about that, I did look. I didn't see that any other states had done something similar, but I think that there could be an opportunity there. Another interesting example is in Iowa. The state has partnered with their Board of Pharmacy, and on their website, they advertise that individuals can access free naloxone without a prescription at their community-based pharmacies. So that's an interesting partnership between the state and the Board of Pharmacy to provide additional access and affordability. And there are several states that on their State Department of Health website have interactive maps that specifically talk about naloxone availability at retail pharmacies and then show based on zip code where those pharmacies are. So those are a few things that we're seeing at the state level.
That's super helpful. Yeah, and I think that, you know, as we see access to more generics and things like that, hopefully those types of models will start catching on. And Bridget, are there things happening? One of the big barriers that we have talked about, right, has been the need to ask questions, right? Even when it's OTC, as we learned today. Are there things happening in the pharmacist education arena that could help reduce some of these barriers, either when it comes to stocking or dispensing?
Sure. Yeah. I mean, as pharmacists, we are constantly, re-educating, relearning, learning new, and having that opportunity to grow our skill set and our repertoire. And similarly with our pharmacy technicians and others on the team at the pharmacy. So it is always an opportunity to take advantage of how we can help to perform or supply some new and updated information. As far as naloxone is concerned, making sure that folks recognize the signs and symptoms of and helping to relay that to those patients or to that family or caregiver so that they know how what they're looking for, but then how to use that specific product. Especially when something goes from a branded prescription to a generic over the counter or vice versa, there might be some differences in technique and how to utilize that. And so as APHA and or other places are continuing to put out additional information and education for pharmacists on the training that they might need to help with those patients. The other thing that we're consistently working with pharmacists and others in, across the healthcare spectrum is some of the stigma that might come along with these products. Recognizing that while somebody might be interested in having naloxone, it doesn't necessarily mean that maybe they want it on their body for being able to utilize it whenever a situation may arise. It might be for their family, it might not be. It doesn't really matter as long as they're using it appropriately and to the right patient population. So how we can have those conversations, so helping our pharmacists and technicians to ask questions to maybe help them identify what the best option is for them, but not to help preclude them from getting something. And, to decreasing some of the stigma that might be associated with that. and obviously for the patient themselves to kind of put themselves out there to go and to seek this out and to stand in the line and to have it rung out, and maybe others around you giving some, different perceptions or views on that. So there is a consistent amount of education, re-education going on the topic, and it's really important that as new information becomes available, that we send that out and share that with our pharmacists and our members.
Yeah, thank you. That's yeah, because those pharmacists have the opportunity, instead of being a stigmatizing conversation, that can then be a conversation where they become another layer of connection and caregiving that's available to folks, which is a really important piece of this whole conversation, and part of why the community-based organizations are such successful distributors and such important distributors, because they are this really important touch point for folks. Beth and Katie, I want to sort of turn that same question to you. Have you seen anything happening in states or within the VA around improving pharmacy or beyond pharmacy access to naloxone that people should be aware of?
I think that one thing that I've seen, I think somebody mentioned on here about like the vending machine kind of example, right? And we have that, Galveston County, which is just neighboring to Houston, has implemented that, and they have, now they have these naloxone vending machines around the county. And I think that's a really helpful model because it allows people to kind of just get it when they need it. And I think that kind of thing can be expanded. And I would really like to see that in places that people are going to, right, where they might be using drugs, or they might be prompted to be aware that this is something they need, right? So I'm thinking like concert venues, things like that, because again, like even just, to go to like to think, you have to think ahead to be like, oh, okay, I should go to CVS or Walgreens and buy this thing. And I mean, that's not necessarily like a huge barrier, but I think that there are a lot of people, especially people who maybe don't use regularly or who don't typically use opioids, right, but might be at risk because they're using something else. And so just having it in locations where other populations might be, and especially in locations where drug use might be happening, I think having it in that kind of like vending machine model in those locations could also help reach an audience that, is maybe not going to be reached by like harm reduction organizations, and maybe isn't necessarily going to like take the step of going to the pharmacy to get it just because it's not like at the forefront of their minds.
Yeah, I think that's an essential piece of this, right? Because it goes back to this conversation about why this type of access matters at all, right? And it's potentially reaching people who are vulnerable in different ways, right? And who, especially today, as we know, the drug supply is incredibly unpredictable and it is continuing to change. So people really don't know what is in their drugs. And so experimenting is a lot more dangerous than it was 20 years ago. So is using regularly because the supply is so potent, but experimentation doesn't have the leeway of forgiveness that it once did. And so pharmacies and potentially things like vending machines strategically placed, right, could help really fill that gap. Beth, did you want to add something about that?
I actually am. We have a vending machine at our little VA, so yeah, I'm really hoping that I can put at least state purchased, community source naloxone in there, because I don't think that I can put VA purchased naloxone in there because it needs to be through a prescription. But other things like hygiene kits, syringes, wound care in that vending machine. Another thing that I've been working on is getting like wall units in our housing sites, ones where people can, they're unlocked and people can just take it if they need it, no questions asked, kind of thing. And staff would replace that with, community, like state purchase naloxone. And then I mentioned, I'd love to see VA canteens selling it in their store, But the same token, it makes me really sad if someone purchases that when they could get it for free, right? I've seen signs where, like, it's this beautiful display in the retail pharmacy where it's like, over the counter, no prescription. And someone had added like a post-it, like, paying for naloxone is dumb. It had like a QR link of where you could go. So in my utopian vision, I would have, this partnership between like retail and, the community-based organizations where, like, yeah, to navigate some of those barriers, like cost, which is such an important one.
Yeah, it's such an important barrier. And I know, like, one of the things we've talked about when naloxone first went OTC, I was super excited. So I was like, well, I have to go buy some just because I can. Um, and my pharmacy locally, when I was checking out, they were like, psst, you can get this for free if or your insurance will cover it. So it would be cheaper if you just did it that way. Um, and yeah, I think so. We still have a long way to go in terms of making it more affordable for a lot of people who use drugs, for most people who use drugs and need it. But at the same time, having that availability is a particular benefit for certainly a portion of the population who's at risk and may not even know they're at risk. So, yeah, I think that's really important. I appreciate all of your thoughts on that. I think before we wrap up, and I definitely encourage folks, we've gotten one awesome question in the Q&A. If you've got more questions, pop them in there, please, because we'll try and stick around till the end if you've got questions. But then also before I let you go, is there anything else about improving, like what else should people know about continuing to improve naloxone saturation in our communities generally, both through pharmacies, through other resources? What would you want people to take away from all of this? And I'd ask that of all of you. Bridget, if you want to start.
Sure. I'd be happy to. I think one of the things that I'm hearing is there's still opportunity to increase that community saturation due to a variety of barriers that are out there. But what I'm also hearing is there's a lot of interest in helping getting this to the patients and to the individuals that need it. And I think the best way for us to do that is to truly collaborate together. So the community-based organizations working with the pharmacies and, instead of saying, well, I don't know why they're doing it that way, like how can we help to connect and to build that bridge? And it takes, yes, I will agree, pharmacies and pharmacists are busy, and it can look overwhelming when you walk up to that pharmacy and you see a line or the phones are ringing. But deep down, genuinely, pharmacists are there to help. They went into it. You ask a pharmacist why they became a pharmacist, they want to help their patients. So I think that that's something that is going to be really valuable to capitalize on with our different community-based organizations and partners is how do we help to build the bridge so that there's multiple locations, there's multiple places where an individual, a parent, a caregiver could access this and help to just really increase the availability and options across the board. So that would be kind of my take-home message and something that there's going to be barriers in a lot of different ways, but how can we all, I think this is a great first step, not even a first step. I know that this is one of the steps in the many different stepped process. So I really appreciate the fact that we are able to kind of connect and work together on ways to increase access and make it more affordable.
I'll jump in and I'll underscore what Bridget said. And I think there's really an opportunity for pharmacies to partner more closely with states with overdose and education naloxone programs, because as we know, we are entering a more resource constrained time, and that community-based distribution of naloxone really should be reserved for those who are really needed, who don't have access to health coverage, who have other barriers for accessing it in a pharmacy. And so if states and the pharmacies can work together to move more people who are able to access it through a pharmacy to the pharmacy, I think that would be really beneficial in thinking through how to maximize and optimize the limited resources that we all have.
Beth, do you want to jump in with anything that you would add?
In all honesty, I was getting distracted by answering the questions in the chat. So no, not at this time.
Okay, no worries. Yeah, we'll definitely get to that question. It's a great question. Katie, did you have
Um,
a sort of a takeaway for folks?
Yeah, I think that one thing that's coming out of this, I think, because one pushback that I've still gotten from people isn't necessarily about the stigma, it's about the concern, like for example, with the vending machines, I've heard people say like, well, will people actually take it from the vending machine, or is it going to expire? Same thing with folks like who I've heard from, like for example, like first responders who've said like, well, these like community outreach programs, you put it out into these community providers and people just take it and then it doesn't get used and it gets expired. And so I think that there's some of this, like, again, I don't think it's a stigma thing. I mean, I think it's more like a logistical or like resource kind of concern that some of these efforts like will end up wasting the naloxone. And I do agree with the point that like there are resource constraints that we have to be aware of and mindful of. But I also do think that this is a case where duplication in some instances is going to be necessary, just to reach the populations that we need to reach, right? And so to me, like, I feel like I'm more concerned about just making sure people have it, and I would take the duplication, over kind of trying to like make sure none of it is wasted per se, because I think that, I mean, I don't know. I think that the most important thing is getting it out there as much as possible.
Yeah, for sure. And I mean, that's something we've seen in terms of like in a rural county in Arizona, right? We've seen recently that I was talking to someone and she said, we have so much naloxone now. It's actually like we have reached true saturation. Like we have so much that we've been able to share it
Yeah.
with neighboring communities who are struggling more to get access. And they've also seen a big dip in like a big drop in their overdoses. So, yeah, that's super important. And thank you, Jessica, for sharing. We've done a little bit of work in the expiration. Of course, some organizations are going to be limited on their ability or like the legality of distributing or selling expired naloxone, but some states have actually made an effort to allow the distribution of expired naloxone because research has time and again found that it is still effective for safe and effective, not just effective, but safe and effective for 10, 20, even 30 years after the expiration date on it. So that was something we were really excited to hear and would love to be amplified and shared with folks who do raise that as a valid concern, right? And I do want to get to this question around getting naloxone to folks who were recently released from carceral settings or their loved ones, right? Like, what does that look like? We know that people recently released from jail or prison are at much, much increased risk for overdose. Um, are there programs that any of you are aware of, policies that you're aware of in place that have helped improve access to these populations?
Yeah, I can put my state of Maryland hat back on and talk about a law that we passed, I guess 2 years ago, 2 or 3 years ago at this point. It was called the Statewide Targeted Overdose Prevention Act. It's actually 2022, so I guess it was 3 years ago. And that required that certain entities that were most likely to engage with people who were at greatest risk of using drugs or dying from overdose offer naloxone, and one of those named entities in the statute was correctional facilities. And so ensuring that the state provided the naloxone free of charge to detention centers and correctional facilities so that they could then offer that to individuals as they were leaving was one policy approach that the state of Maryland took. And I think that that is becoming more common nationally. I think a lot of states are working very closely with their state health departments and their correctional facilities to ensure that that is an access point.
I love that for Maryland. I would love to see that here. We don't have a state law like that, but I can say that the Harris County Jail and also the Travis County Jail, which is where Austin is based, they do have a program where they distribute naloxone to people that are exiting the jail. And I think one of them now, they used to distribute it directly, but now they have another care provider that they link them up with where they can get that access. So those are some local efforts to to provide that access to naloxone for that population.
Yeah, and that brings us right back, right, to the fact that a lot of the time the way things are done is specifically it's the way that makes the most sense or is the most feasible in these local communities. I know I'm in northern Colorado, and our local like work release programs have on-site access to naloxone for folks. And so, yeah, places are starting to figure out the value of this, but it's a really, really important population to get naloxone to. Um, before I don't know, we don't have any more questions from our audience, but I appreciate them sticking around. I really appreciate all of you sharing your experience and expertise, and the thoughtful conversation that we had ahead of time and that we had today. Does anyone else have anything that you'd want to add before we give folks a couple minutes of their day back? No? Good. Well, oh, Beth.
Very broad, but I do like that even for some cases where there's oversaturation, I do think there's a greater good too in breaking down some of the stigma and normalizing it so much that people don't bat an eye as much around naloxone versus, yeah, 7, 8 years ago. I feel like it was much more of like, the enabling concern. So I do like that it's been mainstreamed. I'd obviously love to see that for more like harm reduction services offerings.
Yeah, for sure. I mean, I think that's maybe arguably one of the most important things about pharmacy access is sort of just putting it in front of people and being like, look, here's just this ordinary medication that's out there. Yeah, so I love that. I love thinking about that as a takeaway. The more naloxone we have in our communities, we know the more opportunities there are to save people's lives. And that is, at the end of the day, like, that's what we want to see. So we'd love to see even more and even more accessible naloxone in communities. So thank you again, all of you, for sharing your expertise and your stories and your opinions today. And yeah, we'll let folks have some time back, and we'll see you later.
Thank you so much.
Thank you.